I have take one now. I'll give it to the wife here. Good morning.
All right, folks, it is 11 o'clock, so if you join us, stand and make the pledge. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Again, good morning, everyone. Welcome to Government Day in Augusta, October 11th. My name is Andy Hunthausen. To my left, Commissioner Tom Rolfe.
Good morning.
CAO, Chief Administrative Officer Roger Baltz. Director of Public Works, Jenny Chambers. And Dustin is the head of the shop, and he will be talking to you a little bit about that and the work that happens at the county shop. So we'll introduce him further in a bit. Oh, to my right is Commissioner Candace Payne.
At your service.
We have
Unless I don't like her.
Under Sheriff Brent Covert, welcome, and Amber Johnson's here from the Health Department. She is Communications Specialist, I think is your title. Great, so welcome everyone. We usually start with our reports, and Under Sheriff, you get to be first, and I hope you know, get a good joke or something for us. Oh, I'm sorry to interrupt you. We're gonna remind folks, again, we have the camera going, the legislature has told us that we now have to record all of our meetings via video, and so we're gonna ask that our presenters come up to the podium so that they can talk there, and then after they're done, if we have questions or comments, raise your hand, you come up to the podium so you're on camera and you can ask your question or make your comment. So we're required to do that now, so we're trying to practice and get good at it. Welcome, sir.
Thank you, Mr. Chair, Commissioners. Good morning, everybody. The sheriff is at a violent crime symposium, so he is not able to be here today. He's sorry about that. Just some goings on with the sheriff's office. We have probably four deputies that are in various stages of training. One at the academy, and the others are just about done with FTO, which means they'll be out on their own soon, hopefully. Give some of the other guys a break. One that you will see will be probably in about 6 more months. He'll be the deputy in Lincoln, so you'll probably see him every once in a while when the deputy's not up here. And you will also see in January we do our switch over for the Wolf Creek area, and we have picked Ryan Zarski. He has been with the sheriff's office about almost 5 years now, and he'll be doing his rotation in the Wolf Creek area, which means you will see him up here also when people are around, or when they are around, coming up and helping. So that's what that means for the area up here. I tried to talk to Devin, didn't get a hold of him before I got here to give a quick update on what may happen up here, but wasn't able to get a hold of him. We are still looking for detention officers in the detention center, which I think that's an ongoing process that will be going on for the rest of our lives, probably. But anyway, they are making do with what they have. They have knocked down some of the numbers. We were up to 200 at some point there, and a lot of that was Department of Corrections holds, and we were able to get some of them where they needed to go, which brought our numbers down, which is good for everybody. Trying to think of anything else at the sheriff's office. If you do call down at the sheriff's office, we will be looking for a new secretary. The one that the sheriff had there decided to move on somewhere else, so we were in the process of looking for another one starting today. So we will take care of you if you call. Always glad to hear from you. So I can take any questions that you might have.
Thank you. Any questions from the commission first? All right, how about public questions or public comment? If you have a comment, again, we'll invite you up to the podium to be part of that.
Commissioner, just one thing to add, if you do have a call or something for the sheriff's office, I know everybody has been around for quite some time and knows that you can always get a hold of Devin, but if he's not around and you can't find him, make sure that you call our dispatch and somebody will come right away. So, thank you.
Thank you, appreciate you being here. All right, Public Works, Jenny and Dustin.
Thanks, Commissioner. Again, for the record, my name is Jenny Chambers, the Park County Public Works Director. Just a few updates for you guys today, and then I've got a couple special topics to kind of fill in at the tail end. The first one is just to let you know we completed a Elk Creek Road erosion project. They installed 175 cubic yards and some riprap on the road shoulder and over 200 cubic yards of pit run material just to help with erosion issues on Elk Creek Road location. Probably in the next month or so, it could be the end of this month or probably first part of November, we just provided a contract for called Dustbusters Enterprises to apply magnesium chloride to the upper 6 mile section approximately of Sun Canyon Road. The goal is to still get that done this fall to help get that in place for over the winter, and that'll help next spring and summer keep that road together. So that's still moving forward. We also have a bid out right now. It'll close the end of October for preparation of a project this spring and summer, which is also Sun Canyon Road. It would be I think it's the lower portion of Sun Canyon Road, where we're gonna use 20,000 tons of our stockpiled gravel to put on that road for a major kind of gravel improvement project on the portion of Sun Canyon Road this spring, summer. So we'll see what the bid comes out on the load and haul. Hopefully it's within our budget amount. So hopefully that project will move forward, but we let the bid out this week, and so we'll see where that tail end on that project moves forward or not. And then just a special topic I wanted to highlight today. So we didn't have a lot because it's kind of fall. We're kind of preparing for snow and snow season, so I thought it would be helpful to introduce everybody to Dustin Knoll. Dustin is our maintenance, our fleet manager and maintenance shop supervisor. And they are responsible to repair and maintain approximately 135 fleet vehicles across the county, from graders, water trucks, backhoes, loaders, dump trucks, pickup trucks, and then of course our snow plows. So it's a huge operation, and I think where we get a lot of bang for our buck is these guys are extremely trained, and the way they can fabricate and do some things for equipment is just amazing. There's some good welders in his shop, very good innovative folks to put stuff together, and just keeping the maintenance of the vehicles, make them last longer, and then if they're through their life on hours, we surplus those and we get good bang for our buck coming back in. So when we do a public auction and we get money when we sell used vehicles, we get that back and it goes right back into the fleet maintenance. So it's really impressive. Even just a two-wheel drive vehicle that we sold actually today from a two-wheel drive pickup, was it 2004?
No, actually, it's a 1995.
Oh, in 1995. Yeah, 1995, we were talking about a lot of vehicles coming up today. 1995 two-wheel drive vehicle that was in our road department originally, and then went to our building maintenance staff. We put it out on public auction. We got $4,500 for that vehicle, which is just crazy for somebody within Missoula. So just, that's one example. Like the guy came over and picked it up today and he's just thrilled. So this morning. But for the snow plows, we've got 14 snow plows. And this winter, I don't know, we've talked about it before in the past, where we had a hard time getting the equipment over years and years and years. This fall, we're gonna be getting 4 new snow plows. But those are being ones that we've ordered 3 or 4 years ago that we're finally getting built up in Conrad to get all put together. So that the supply chain has been really tough to get some of these larger cabs and chassis to get all this stuff put together. So then we will surplus the 1995-ish ones moving forward. But there's some that we have in our fleet that's 2010, or 2010, 2012, that are kind of midway through their life right now. And because they're midway through their life, Dustin and his crew, his team of 4 mechanics, did a complete overhaul on that equipment, so that we can get it in really good shape for this winter. So we'll have maybe some new ones, and then we'll have this 2010s, 2012s part of the fleet. And part of that project was they had to phase it but was to get the sander box, which they came with mild steel sander box. And if you can imagine, when you're putting salt and sand and stuff in there, it would corrode and really wear out. So a goal that Dustin had was to phase over time to get those switched out to stainless steel sander boxes so they don't erode and corrode as much. And so this year, we actually finished the last phase of the vehicles to get those new sander box on for that fleet. So I wanted to highlight some of that stuff. Some of the innovative things that they've done, some things that we do for surplus and public auction, just to highlight that you see Lewis out in the grader, you see him out in the dump truck, but there's a whole nother, operation going on back in Helena to help keep those vehicles maintained. So that was kind of the special topic. I wanted to see, Dustin, did you want to add anything to that conversation for the group?
No, nice to meet you all, to be here, so, I think you covered most of it.
Okay.
Thank you.
Take great care of Lewis. Lewis is a great guy, he helps us out by being kind of his own, mechanic and operator, and so we love having Lewis here. He does his best to keep his equipment well maintained like we do in Helena.
So, yeah, that's a good point. So our equipment operators, especially for the ones in the district areas like Lewis, we have Sean in Wolf Creek, and we've got Kenny in Lincoln. They actually do some of their own maintenance as well, at least the servicing and things like that, because we are kind of remote. So that was basically just kind of the highlights at that tail end. I did want to also highlight to you guys noxious weeds. So noxious weed management is important in the spring and summer as you see they're growing. But there's also certain weeds that you should do some applications in the fall time as well, when they're dormant, and then we're prior to coming up the springs. And so there's a calendar, again, for the Montana Weed Control Association for the 2025. It might be the first calendar you've seen for 2025, which starts in January. But there's not pictures of weeds necessarily in them, thank goodness. There's just pictures of nice scenic photos on the top, so grab one. But on the bottom, there's some interesting tidbits on helpful hints on some weed management activities. So it's still weed related, it's just you don't have to see the weed pictures. And then the last thing is there's a solid waste board meeting, scrap your guys' Augusta Solid Waste District meeting today at 1 o'clock here in the room after Government Day. So that's what I had for you today, Chairman.
Thank you, Jenny, appreciate it. Any questions for Public Works? Please come on up and, if you would, please introduce yourself.
That's why you do that. You make us from wanting to go up there.
Well, we didn't do it, but we have to.
My name's Terry Clark, and we live on the edge of town. Anyway, I do a lot of walking around town, and I have noticed that knapweed is starting to take over our town. It's scattered all over. I thought it was just in a certain area, but over the years, I guess it keeps spreading. So I was wondering if there was any plans to spray that. I know there's some on private property. I don't know what philosophy is there as far as taking care of that, but.
Okay.
So I was just wondering if you could address that. Okay.
We'll
thank
do.
you.
Yep, I'll answer
Thank
that.
you. Yes, please.
I happen to be the designee for the, and I have to remember to say noxious weed board. It has nothing to do with that legalized stuff. This is noxious weeds. And we had a noxious weed board meeting last week. And Christian, what's Christian's last name?
Christian Leonard.
Leonard is head of he runs that, and actually we have, the county owns sprayers that you can come and get and use. So if people wanna do their own weed control, they can. But if you call, I bet she has the weed board number on, she's got it memorized? Well, anyway, that's where you go. You guys pay your taxes, and we're supposed to be controlling these weeds. They want to encourage you, they want to encourage people to take care of it themselves, or they will help you do it, or, I don't know, do they do it for you? They won't do it for me, they make me do those. So,
I was gonna Google the noxious weed number for everybody. really quick.
Well, you're Googling that. Thanks, Commissioner. Yes, I think the law is that all of us are responsible for the weeds on our property, so we must manage our noxious weeds. But if there are weeds in rights of way or whatever, we can help with that, and depending on if it's us or the state or whatever it might be, we do have a spraying program. I think there is a tank sprayer up here during the summertime.
Mr. Chairman, yeah, in the past, we had the weed sprayer that Commissioner Payne had talked about at each of the district locations. In Augusta, though, unfortunately, we lost the landowner that volunteered to maintain that equipment for us up here during that season. So we are looking for next season. We're looking for somebody that would be willing to host the weed sprayer, to have it on site and then be available to check it out to people to use. We will maintain it. We will make sure that it's transported up here and then returned back to Helena. But we do need somebody local in the area that can be able to assist us with that management. So that is a possibility, but right now we don't have anybody up in Augusta at this time.
Does the county provide the spray for
No.
it, or each individual has to buy their own?
Yeah, Commissioner Payne, that's a great point. So if it's a private property, then you as a landowner, the law does require you as the landowner to maintain your noxious weed. Christian Leonard, through the noxious weed program, has a complaint process in place where if you have landowners that have really egregious violations or things that exist, we provide them a letter just to provide customer service, to have compliance assistance if needed to help them manage their weeds. We don't take a really strong enforcement arm unless it's actually needed. It's mainly to get education and outreach out there on giving them that information on how they can manage it if they're unsure. But if you use one of our sprayers that's available or your own, you do have to pay your own, get your own herbicide. If you're really, really large rancher or have a lot of land, there is a grant program available that can be 50-50 match on the herbicide that you may use, but you have to have a weed management plan through our program. And like Sarah and Mike Cobb is actually an Augusta individual that's on that weed board as well. They do a great job. So there's local resources available too that can provide assistance in this area. I know he'd be willing to reach out to landowners or help you with your these weeds as well. But if you want to talk to Christian Leonard, our noxious weed coordinator, or if you have private properties that have large nap weeds, you can give them a call. His number is 406-447-8372, and that's also on the website. There's a really good website we have for the noxious weed management program. But yeah, mainly the landowner's responsibility, and we can help with education and outreach and kind of what kind of herbicide works best for what kind of noxious weeds may exist. So.
Yeah, good point. Christian and staff, they're not out driving around looking for noxious weeds, so it is a complaint-driven program. So we encourage people, if they see out of control noxious weeds, that they call, and then we can help educate that landowner and help, here's where you can get your material, So we try and help them out. And it's only in extreme cases where there's refusal or they won't try to help at all that we would then maybe take further enforcement measures, but that's not very common. Very rare. Usually we just try to help them out. Hey, you have noxious weeds. Here's your options. How can we help? So, yes. We send Commissioner Payne out. She's on the noxious weed board.
Damn right.
Pulls
And
them.
I'm
She
not as
pulls them
nice
one
as
by-
Christian
Pulls
is.
them one by one.
And then I take them to the landowner and put them up their nose so they remember.
I hadn't heard that part, but.
Well, I haven't tried it yet, but it's I have this plan in place.
Mr.
Yes,
Chair,
sir.
if I might just follow up, I'd like to just emphasize the great job that Dustin does of maintaining the equipment for our county. And I worked with him in my old life. I sold cars for Helena Motors, and before that for Grimes Motors, and sold several vehicles to the county on through the bid process. And they were always so good at making sure that they had built vehicles that did the job well, and they really know what they're doing, and then they maintain them well. And I was just looking, there's some vehicles that they just sold, like you're talking about, that were around for a long time, and the reason they're able to get that kind of of money out of those old rigs is the way they take care of them. And, they really are working for you, keeping the cost of maintaining vehicles down. Dustin and I, we were just talking about, they're starting to take a look at when it's time to replace some of the big equipment. They have them on a regular routine, and then they look for the time of when the market is right, when the opportunity is there to do it at the most efficient manner for you, and like I say, to save tax dollars and have good equipment so that when you need some work done, the equipment's in good running shape. So they do an excellent job. They've got a good staff down there at the maintenance office, and you've got good people out here running the equipment. So they need to be appreciated for what they do.
Thank you, Commissioner. Absolutely, I second and third that, Dustin. Thank you for all your good work.
Thank you.
All right. Anything else for Public Works or other comments? Okay, we'll move on to Forest Service. It doesn't look like Kyle's here today. So we'll move on to Public Health. And Ann, good morning.
Good morning. Commissioners, hello citizens of Augusta. Our topic today, I just kind of wanted to bring some, remember I was here months ago talking about that Casper survey? Oh, by the way, for the record, my name is Amber Johnson. I'm with Lewis and Clark Public Health.
Thank you.
Yeah. So I think I was here months ago talking about the Casper survey. It was a door-to-door survey that we did throughout Lewis and Clark County. So we knocked on doors with over like 30 volunteers over the course of a week, all over the county, Augusta included. It was actually a 5-county survey, so we did Jefferson, Powell, Broadwater, and Marr as well. So it was a very big project. And what that survey provided us was just better insight about who our community was, what's going well, what's not going well, what people are concerned about. So I brought the official report from that survey. Our brilliant, talented epidemiologist, Valerie Stacy, put together these documents, so I'll hand them out. I'm gonna keep one so I can reference it. And then I also brought a copy of my latest public health column. And one of the things I want to talk about was the good stuff. Because so often in public health, we're so concerned, about scanning our environment for what is, could potentially socially or physically hurt or harm or kill our community, right? That's kind of our job in public health. However, sometimes we get so focused on, weeding out the bad stuff that we forget to celebrate the good things in our community. So something I wanted to highlight in the Casper report after the door-to-door surveys, something to celebrate is that yes. So if you'll turn to page 5, our biggest strengths. I just kind of wanted to just highlight some good news. 94% of people who were surveyed feel generally safe within our community. I think that's something to celebrate. 91% believe our community is a good place to raise children. And 78% of people believe they can get the health care when they need it. And 88% of our community believes that it's a good place to grow old. So I think those are, accomplishments worth celebrating. It's made possible by the hard, work of professionals, not just in public health, but our commissioners, our sheriff's department, public works, everybody who just shows up and tries to, pitch in and make this a good place to raise kids and to grow old. So I think that's worth celebrating. You'll also notice that we talk about what people believe is the most important elements of a healthy community, and then the concerns. I think the most serious health concerns that we found from our door-to-door survey The biggest one was alcohol and substance misuse. People are really concerned about that, and rightfully so. And then mental health, which includes depression and anxiety, was a concern that people had for our community, as well as lack of access to healthcare. Speaking of which, so I wanted to also give you an update that I am herding the cats and getting reps from Pureview, Blue Cross Blue Shield, as well as members of the Augusta community all together next month. We're having a flu and COVID clinic before government days next month. And then we'll be having government days, and after which we're going to gather some people around the table and talk about access to public health here in Augusta moving forward now that Sarah has retired. So I wanted to just let you know that that's something that we're actively working on, getting the right people around the table to talk about access to healthcare and public health here in Augusta. So know that we care, and it's just a matter of getting all the right people around the table at the same time, which can be a challenge. So, yeah, you're more than welcome. Obviously, it's a 10-page document. So, I hope that you'll give it a good read. It's pretty easy to read. Val did a fantastic job of making sure that it has some great visuals and some great data elements. It's super easy to read. It's pretty concise. So.
Is this available on the county website?
It is available on the county website as well. You can go, so this is a project of the Healthy Together Steering Committee, which in many ways is organized by Public Health, but also includes St. Peter's Health, Pureview, Rocky Mountain Development Council, the United Way, Shodair Children's Hospital. So the Healthy Together Steering Committee is made up of all those organizations interested in population health within Lewis and Clark County. And so this was kind of a collaborative project that we all worked on. And so you can find this report if you go to the Lewis and Clark Public Health website and you visit the Healthy Together Steering Committee page, then you'll see a link to the Casper report and the Casper survey. So, any other questions about the report?
Thank you.
Yeah, oh, just one more thing. So this is, the Casper report is just a small snapshot of a larger project we're working called the Community Health Assessment. And that is a much more robust document. It happens every 3 years. And so our epidemiologist, Valerie, is currently working on our Community Health Assessment. And that will be published, I believe, in December. So we'll keep you posted at future government days about the Community Health Assessment, when it's published and where you can read it. We'll probably bring you copies. In addition, after we create that Community Health Assessment, we then go on to create a Community Health Improvement Plan, right? Because you can have all the data in the world, but if you don't make a plan and you don't execute that plan, right, what's the point? So, really, this type of assessment, and particularly this door-to-door survey was super helpful, helps us know as a public health department and, as healthcare professionals in general with the Healthy Together Steering Committee, like what we need, what's most important to our community and what we need to focus on that, is in line with what people want us to focus on. So you'll be seeing in December and January a community health assessment followed by a community health improvement plan, which will kind of guide 3 years of our strategic plan moving forward, just so that we know that we're on the right track trying to meet our community's needs and what they want. So something to look forward to.
Thank you very much.
Yes.
Regarding the COVID shots and the flu shots,
Yes,
and you mentioned that it's going to be right before the public meeting.
correct.
So are we talking 10 o'clock, 6 o'clock? What?
It
Give
is,
us a time so we can get
sorry,
that
I'm trying to pull it
information.
out of my memory. So this starts at 11, I believe it's from 9:30 to 11 a.m.
And that is on November 8th.
Yeah, November 8th, so right before government days.
And in this building.
In this building. And we're gonna have our public health nurses here, and maybe even a couple people from another mobile van. And we'll be doing flu shots, COVID shots, and then we'll have our government meeting, and then we're gonna have another kind of, meeting about just kind of public health in Augusta moving forward now that Sarah has retired, so. 9:30 to 11.
Is there any place this could be posted on like 2 days
It-
ahead of time, or is
Yeah,
this-
it is, so it's, I know that Sarah, she's been putting up posters, like actual physical posters. I'm still working on Sarah to get, Facebook access to the Augusta Public Health page. It's a technical challenge right now that we are trying to overcome. So, but I know that Emily, you run a website, so, I will by early next week, I'm going to put together an event on Facebook about our COVID and flu clinic here in Augusta, and then I will share it, and then anybody here, you can, feel free, I know that I don't have access right now to the Augusta Facebook page, but you can just follow Lewis and Clark Public Health on Facebook in general, and then feel free to share that. You can share it to all the websites and, or Facebook groups here in Augusta. I know maybe, has Sarah brought you a poster for the senior center?
It would be over next door.
Yeah, okay. So we'll make sure that you guys have just physical posters as well as some online invites for the flu and COVID clinic next month, a month from now, so.
Okay, thank you very much.
Anything else?
Thank you, Linda.
Any other questions, comments for public health?
Yes.
Come on down. Sorry. It's like the price is right.
Yeah, Kurt Vesey. I see on my taxes I'm spending, we're being charged for mental health. And I was just curious how the money is being spent specifically for mental health. Because I know,
Well, I could tell you about some of the projects we're working on. I am not a tax specialist, I will tell you that. I couldn't break that down for you. I can tell you some of the projects as far as, so we have, we kind of head up a coalition working on mental and behavioral health in Lewis and Clark County. Again, it's a collaborative approach with multiple other organizations. And so we are trying to deter people from, one, going to the emergency room, and two, people going to jail, right? So we have a team that has, that they're basically first responders.
Mobile crisis
It's a mobile, yes, thank you, Andy. It's a mobile crisis response unit. And so when somebody's having, mental health challenges, instead of putting them in jail or sending them to the ER, we have a mobile crisis response unit that goes and just kind of meets with them and tries to meet their needs. In addition, we are working very hard, and it's very exciting that we are opening the Journey Home is opening like an inpatient, like crisis response center in Lewis and
Crisis
Clark.
stabilization.
Yes, thank you. I think Andy could probably answer this better for you. Crisis stabilization center. Yeah, if you would like to go to.
I'll jump in as soon as you're.
Feel free. So yes, the Journey Home is opening a crisis stabilization center. It is for short term. It's for when people are really struggling with their mental health. Again, instead of going to the hospital, instead of going to the jail, they will have a place to go and stabilize. Which saves us a lot of tax money in the long run, because if we can divert people away from the jail, away from the emergency room, and get them cared for and stabilized, that is actually going to benefit, your taxes in the long run, or they'll just be spent more effectively. Does that make sense? So that's a big project that we're working on. Anything else you want to add?
Sure, I'll mention it, and if I forget something, you can jump in too. But we have a significant investment in behavioral mental health across the whole continuum. So where specifically your dollars went, they're in the mix here somewhere. So, but we have, so there's a continuum. We've really been focused on crisis care. We do have, as talked about, a coalition of community leaders, St. Peter's, Chaudere, law enforcement, both city and county are involved, Peerview, Health Center, Public Health Commission, city. we've all been engaged at the table to try and figure out how we can have the shared responsibility in responding to the growing behavioral health needs in our community. So, as Amber just said, but, so we've partnered to create this mobile crisis response team that's run out of St. Peter's Health. So someone in behavioral health crisis might get a call about somebody that is out there in behavioral health crisis, and so this mobile crisis response team will respond, often with law enforcement, so to make sure the scene is safe, but then the behavioral health folks will be working with this person to try and stabilize them and divert them from entering further into the system, whether that's the emergency room or the jail, if we can de-escalate and get in touch with their caregivers and those kinds of things, and try and get them on a path there. It might be going to the Journey Home, which is a stabilization center, those kinds of things. So that's part of the continuum. There's a place called Our Place in Helena, which is a drop-in center. We contribute to the operation of that facility, where they have people living with mental illness or behavioral health issues that come in and can get access to services there. They have groups and other things. They have referrals to therapeutic services, even down to how do I get an ID, or how do I fill out a housing application on a housing authority, or low-income housing, those kinds of things. So they just try and help get people on track and moving in the right direction.
How is Augusta served?
So they're just going through the litany first, and then we'll talk about that a little bit. But we also have a therapist and a case manager, and a therapist, behavioral health therapist, and an addiction therapy counselor in the detention center, and a case manager in the detention center, trying to help stabilize people that come in there, and we move them, get them in a setting that is more, a greater benefit to them, so we have better outcome. And when they leave, make sure that they're hooked up to services, those kinds of things, so they don't come back, which all costs us all a lot of money. The reality is, in our county, which this comes back to the question and tying it in, that the great majority of services are provided in the population centers. So Helena has the great majority of the services for our county, and people from here, to have a crisis house here, or to have a mobile crisis response team stationed in Augusta, and those are 24/7 operations with lots of people and expense. They probably, there's not need here, but they probably don't have the amount of need that you have in those population centers. So the majority of the services are in the population center. People outside of those population centers can access those services, but it does mean that you're coming, just like you're very accustomed to. If you need something, you're going somewhere to get it a lot of times if it's not here in Augusta. So we do have a significant investment in behavioral health and mental health services in the community, but they are generally provided or stationed in Helena. There is some outreach, public health outreach is doing some things. The clinic is one of those you're talking about coming up. And there are other programs that.
Yeah,
that
one
do
more
some
program
outreach.
I would mention is our Suicide Prevention Coalition. As we know, Montana usually leads the nation, number 1 or number 2 in suicide rates per capita, which is a tragedy, and it really impacts our communities pretty profoundly because we live in small places, and when we lose people to suicide, it hits people hard. So we do have a suicide prevention coalition run through Lewis and Clark Public Health, and we work on things like harm reduction, like figuring out how to, making sure people have gun locks, working on advocacy where people can safely store weapons, with a friend when they're, without there being any legal repercussions when they're, in a tough spot, and support groups in various, so much of what public health does is we really try to, as much as possible, bring people to the table that are interested in the same topic, so we can figure out how we can collectively solve the issue together. So, yeah, there's multiple, I guess, multiple cookie jars.
Lots of different places.
So,
One thing I might mention too is that we're continually going out for other sources of money to help out with both addiction problems and mental health issues. And sometimes there's an overlap there for folks that have both of those concerns that they have to deal with. And I'm working on with a group of people who are getting part of that opioid money coming in from the Montana Opioid Abatement Trust. And we've got some money that's coming specifically to Lewis and Clark County. That group has just made a recommendation to help fund a person part-time in the detention center would be able to prescribe medications for both mental health related issues and for people that have addiction problems. And by having a prescribing person in there, physician's assistant or nurse practitioner in the detention center for several hours a week will really facilitate getting folks taken care of if they happen to be there. And we're working on, like Amber said, we've just recently sold the Journey home to Many Rivers Whole Health, and they're going to be putting together that facility and staffing it full-time to take care of folks with both mental health issues and addiction problems. So, making some great progress, trying to make your tax money stretch as far as possible by looking at other sources of money as well.
and one last thing I'll plug on there is that, everyone's heard the expression that an ounce of prevention is worth a pound of cure.
Yeah.
And that goes for money as well. Like, the more money we can put into prevention work, like, so much of our healthcare system is sick care, which is really expensive. What's less expensive and just happier in general, right, is preventative care. And so, some of the work that we do is preventative, and then some of the work that we do is reactive. And the more money that's, pitched towards preventative care means, the less sick care that we have to provide people, which is just cheaper for the taxpayer in the long run. But it's just, there's only so much money and only so many people. And I like Tom said, and Andy, I think people are really trying to put their heads together and figure it out together, so.
I think there was another question.
Emily Boyles, I'm just an Augusta resident. So many of the insurance waivers that happened during COVID are about to run out the end of the year, including telehealth for Medicare and some other parts that many folks can rely on for mental health and drug addiction counseling that live in Augusta. I know of at least 4 or 5 families that use that here. Is that any of the consideration? Private insurance is starting to follow suit as well with limiting some of the telehealth for those families that need the mental health, because that would be a big boon for folks in Augusta that don't want to get handcuffed to have to go to the Frontier home in Helena or to deal with having to leave their families and small children especially. I know that we have the Montana Warm Line, but they're not a treatment line, they're a maintenance line.
So thanks for the question. 988 is actually a behavioral health crisis line. that is now nationwide, so that is out there. But the telehealth piece, it really came to light during COVID and was very widely used because we couldn't be in, settings where there's a lot of people. So I'm hoping that it continues, at least, especially for more rural communities. It isn't under our jurisdiction whether telehealth continues or not, and whether, insurance companies see that or not, or recognize that or not. I think it's still able to use telehealth. I know that Peerview uses telehealth for a lot of their doctor's appointments, those kinds of things. There's nationwide telehealth. There's companies that have kind of sprung up all over for telebehavioral health, therapy sessions, those kinds of things. But where we might be able to help advocate to secure that is at the legislative session, if they can put that into a little more concrete, if you will, in terms of allowing those types of services to continue. I know it came up and there were exceptions. The other piece of that is federal, so federal Medicaid, Medicare, they started recognizing telehealth and paying for telehealth as like you were at the doctor's office or at the therapist's office or whatever. So I'm hoping that those continue. I haven't heard that they're not going to continue.
Yeah, there was some federal notices that went out very recently.
Okay.
And I'm just wondering if you can use some of those grant monies and some of our tax dollars that take mental health on them towards filling that gap for folks out here in the rural areas.
Well, that's a good question. I think we can look into that, but what I think we can do is advocate for telehealth for rural communities to continue, and that you have access to behavioral health right from your computer at home or wherever it might be. For sure, but thanks for bringing that up. Anything else?
Anything else? Nope, nothing for me. More questions?
Anybody else got a question?
Thank you.
Yeah, thank you. How about any other public comment that is under our jurisdiction but not on today's agenda? Anything else anybody wants to talk about? Commissioners, anything you got? All right. So our next meeting is the 8th, but it's a big day, the 8th of November. There'll be shot clinic, and then this meeting, and then after this meeting, a community conversation about how public health can continue here and what that will look like and how often and what the services will be, all those kinds of things, via Sarah's retirement. It'll look different here. We won't have a public health nurse stationed here like Sarah will be coming in with mobile clinics and those kinds of things more likely, and so want the community to participate in what that will look like and how that will happen. Okay, great. Anything else from anybody up here? All right, the 8th is our next day. Next time we'll meet here, and with that, commissioners, we will stand adjourned. Thank you. All right.
Thank you. Grab
Thank
a
you.
calendar, grab a calendar.
Yes, take a calendar, please.
They're free, they're free.
You're required to take a
Take
calendar.
more than one.
I do. No.
You have one for your wife.
You don't, you don't have to stare at weeds, you don't have to stare at weeds, there's nice pictures on there.
Up a beach.
You guys want a calendar?
Just down at the end of
You wanna take some more?
where Lauren Rice lives.
Do you wanna take the extras? Yeah, awesome, thank you, you
So-
can set them on the table over there.
But my husband lived here forever. Yeah, yeah, so, that's why.
There's very much.
Yeah, thank you. Thanks for coming. Yep, appreciate it.
Yeah, yeah.
Yeah, so it's, we live in one house and there's a daughter and four grandkids live next door. And the bridge live right, yeah. Yeah, it's really nice, guys, with some diapers and little poopy, we can send them back to school. I must see, this is a meeting next time.
So we're about to move on right now.
Yeah. Yeah. I might know, you might know those all, where we
ranking, if we're ranking above the funding line, typically that's a
Right,
good sign,
right.
they usually don't
Did you
juggle
sign
it too
it?
much from that, legislature doesn't, and then, yeah, we'll go officially.
Yeah.
Oh,
I completely understand, yeah, I hope pretty well in other communities, I didn't think like that for 20 years. So, yeah, so I'm pretty familiar with the kind of issues. And I talked to,
Pretty much.
to, them about a couple and how we try to make I've been here 2 years, but unfortunately Larry had cancer his last year. I couldn't jump into things.